Hi, my name is Kelly Jehle. I will be discussing cervical compression and cervical distraction special tests. To start, the pathology these tests indicate is cervical radiculopathy, which is a pinched nerve. This is caused by pressure on one or more of the cervical nerve roots, and this pressure can result in nerve-related symptoms in the neck and upper extremity, such as pain, paresthesia, muscular weakness, altered reflexes, and atrophy. To start with the cervical compression test, the patient is in a seated position and ensure that the patient has good posture. The examiner stands behind the patient and interlocks their fingers like this and places their hands on top of the patient's head. Then the patient is passive during the test and the examiner presses down on the crown of the patient's head. A positive test is indicated by pain or reproduction of symptoms in the upper extremity, cervical, spine, or both. The sensitivity rate of the compression test is 83% and the specificity rate is 34%, making it more useful to rule out pathology rather than ruling it in. Next, the cervical distraction test is done with the patient in a supine position, and the examiner stands behind the patient's head and puts one hand under the occiput and the other hand on top of the forehead to stabilize the head. The examiner then slightly flexes the patient's neck to a comfortable position and applies a tractional force to the skull, which is the distraction of the cervical spine. And a modification to this test is the patient can also be in the seated position, as this places the patient in a more functional position. A positive test would be if the patient's symptoms are relieved or reduced. The sensitivity rate of the distraction test is 44%, while the specificity rate is between 90 and 97%, making it more useful to rule the pathology in than out. It's important to avoid performing this test if there is a chance of cervical fracture or instability. These are my references, and next I will be performing the test for you. This is my patient, Megan, and we will be doing a cervical compression test. In this test, the patient is in a seated position and the examiner stands behind the patient and interlocks their fingers and places their hands on top of the patient's head. And then as the test is completed, the patient is passive and the examiner applies pressure to the crown of the patient's head. A positive test would include the patient feeling pain or reproduction of symptoms in either the cervical region or the upper extremity or both. And a positive test would indicate cervical radiculopathy. Now we will be doing a cervical distraction test. This is done with the patient in a supine position, and I will put my hand under the occiput and put my other hand on top of her forehead to stabilize the head. In this test, the patient is passive while the examiner flexes the neck to a comfortable position and then applies a tractional force. And then this test, a positive indication would be relief or reduction of symptoms, and a positive test would indicate cervical radiculopathy.